Hello, class, and welcome to Phlebotomy 1. This is our training workshop where we will begin to learn the fundamentals of phlebotomy and the art of blood draws. How I direct these type of courses is I do case studies. These are going to start out simple, then slowly advance the more we get into the course over the next 15 weeks. As medical assistants, you will not only be giving reports to your superiors, other nurses, and doctors, but you also, depending on what genre and what floors you work on, will actually have to go over the etiologies and the progression of disease states. So I want to make sure that not only do you understand these processes, but can execute them when the time comes the correct way. So, with this case study, we are dealing with a 75-year-old woman. Her name is Emma. Emma is named after my mother. So please take good care of her during this case study. She is getting the following tubes drawn. We have a sodium citrate, a lithium heparin, and an EDTA. How will you assess and proceed with this blood draw? Now, I just want to let you know this is a little caveat. Before you take the NHA national exam, they do not list the tubes by the color. You have to know the additive that's in the tube and what order they go in. So just keep that in mind for future references. Your first step when you're dealing with any patient is to get the proper identification. With Miss Emma, when you call her back to the chair, it is, "Hi, my name is Leslie. I'm your phlebotomist. May I have your full name and date of birth?" Have them spell their last name, and you want to match that to their driver's license or state ID or any identification that they have on hand. If you forget anything throughout this entire process, never forget to get the patient's identification at the beginning and the end of the blood draw. Some of your experienced phlebotomists will get the identification at the beginning, but not the end. You want to make sure that everything is labeled and correct before the patient leaves your chair. If this cuts down on any of your patient errors, and unfortunately, no hospital, no jobs that I have worked and that I've seen give a leeway for not having a proper patient identification. So next is coming into your processes of consent. Informed consent is that document that when the patient sits in the chair, you give them which is their patient bill of rights, their HIPAA policies. You want to make sure they read over it and understand what they are reading. That is the time that you answer any questions that they may and have them sign on the dotted line. After that is done, then it comes to your implied consent. Your implied consent is when the patient extends their arm to you saying that they're ready for the blood draw. Now keep in mind as well, the patient can extend or rescind their arm at any time in the blood draw. If that happens, you must stop and ask the patient what is wrong. The patient in this case has the right of way. So when you're drawing blood, one of the things that I like my students to get in the habit of doing is doing a patient assessment. This will let you know if you need to take any precautions or make any changes to how you perform the blood draw. With the patient assessment, it's just a few simple questions that you ask the patient while they're getting in the chair. You want to ask them, are you fasting? Do you faint at the sight of blood? Do you have any arm implants? Or is there any arms that I cannot use? Are you allergic to any adhesive that is like the bandage glue? Are you on any aspirin or any type of blood thinners? Now, why do we ask these questions? These are the main things that when in the chair, I have seen a lot of people have issues with and that need to be prepared for. For example, if somebody is on blood thinners, you want to make sure that they stay in the chair a couple of minutes longer so that their blood is allowed to clot. You might want to change from using a regular Band-Aid to using Coban and making sure that the bleeding has stopped before they leave your chair. With the fainting, dealing with somebody who faints with the sight of blood or even having epilepsy, you want to lay that patient down before you attempt the blood draw just to have the fainting precautions in place. When somebody is fasting or not eating, that can actually change the results of the blood draw. So you want to make sure that they are compliant with the doctor's orders. And also when you are dealing with arm implants, that is, if somebody has had a mastectomy, you want to know where you can draw or can't draw. Nowadays, men and women have fistulas in their arm for going to dialysis. You can have a Dexcom or a blood sugar monitor in your arm where you don't want to put the tourniquet over. And actually, men and women can have mastectomies or any other issue. You just want to make sure that if there's an arm you cannot use, you are being cognizant of that. All right, so bandage issues. If some people have skin sensitivity to adhesives or the bandages, you want to make sure that you do not put a bandage or medical tape on it. If they're allergic to them, you can use Coban, or you can just hold the cotton ball or the swab on the arm until it clots. Some people that have gone through extensive surgeries or extensive treatment, their skin can actually fall off just at a touch. So you want to make sure that you actually maintain the skin's integrity when you are drawing blood. Now, next steps is the phlebotomist. You do quick visual assessment. You want to check for scarring or bruising or texture issues. This is important because Miss Emma is in her 70s. Um, for a lot of people that are in their 70s, they do have wrinkled skin or they don't have as much collagen. So you just want to make sure that you account for this while you're setting up your supplies. This may seem a little bit long, but it's actually not long at all. This will be about the first couple of minutes. You will be set up and you're ready to go. So once you are ready to go, you have had all your supplies in place. That is your new tourniquet, your 22 or your 21 gauge straight needle or a winged infusion set, a needle swab, an alcohol pad, two 4x4 gauze square pads, one bandage, gloves, and hand sanitizer. If somebody says that they are on blood thinners, you want more than two 4x4 gauze pads. You would add by two as the bleeding progresses. Now let's get to work. So you've sanitized and washed your hands, you don your gloves, that means to put on, and you apply the tourniquet and you palpate or feel for the vein. When you're palpating for a vein, you are feeling for turgor. That is that bouncy feeling when you actually press on the vein. Now also keep in mind the patient can decline this draw at any time. Your antecubital fossa, that is the area in the bend of the elbow. When palpating for a vein, you are looking for the strongest and sturdiest vein to support the needle and the vacuum of the tube. For most patients, this is their best vein. If this doesn't work, you can palpate for the cephalic or the basilic veins, which are located also in the antecubital fossa. Always remember to palpate or feel with the gloves on. If you palpate or feel after you've wiped off with alcohol, you must actually go back and wipe it off again. When you do palpate with the tourniquet on, remember that you have to remove the tourniquet and let the arm rest to prevent hemoconcentration, and that is the buildup of the red blood cells within the arm. You have about a 1 to 2 minute mark before you have to remove the tourniquet. Set up now, stress later, stress less later. So when you're getting your needle, you want to check and make sure that the tamper-proof seal is intact before use. You want to put the needle in the hub, and you want to place the tubes in front of the patient or in front of the area where you're going to draw. This actually prevents reaching, and it also makes sure that none of your tubes actually fall on the floor. So your order of draw is your light blue, your mint green, and your lavender. When you're setting up your tubes, always set up according to your order of draw. Position the patient's arm that is extended in a straight line from shoulder to waist. Do not attempt a venipuncture more than twice. Notify your supervisor or your physician if that is unsuccessful. So when you're in the lab and you're drawing blood, your legal limit is twice. If you cannot get the blood after you've poked twice, tap out, go get somebody else. It is okay. You will not get every blood draw at every time. You want to select the appropriate vein for venipuncture. Apply the tourniquet 3 above or 4 inches above the collection site. This is why it's important to know if you have any arm implants where you're going. Never leave the tourniquet on for more longer than a minute. If the tourniquet is used for preliminary vein selection, release it and let it rest, the arm rest for at least 2 minutes. Oh, did I miss one? All right, so you want to clean the area, making smooth circular motions, and pass over with a 70% alcohol. Allow for the skin to dry before proceeding, and do not touch the site as we stated before after cleansing. If you do touch the site, go back and re-cleanse. So you want to attach the needle to the hub, remove the plastic cap. The plastic cap that you're going to be removing is the colored side. The white side is actually the one that's in the hub. You pull the pull the skin down slightly with your thumb. This is called anchoring, and you will slowly but swiftly insert the needle into the arm. If you go too slowly, the blood will actually bubble up on the surface. It'll scare you and it scare the patient. It's a slow, swift movement. After the blood starts flowing into the tube, you want to then remove the tube remove the tourniquet and ask the patient to open their hand if you have them closed. When the blood flow stops, remove the tube by holding the tube securely and pulling off with the needle. Gently invert each tube. Inversion is just a gentle way of rocking the blood back and forth in the tube to mix the additive with the blood supply. So here is your order of draw. It is light blue, your sodium citrate. This must be completely full, and it is 1 sodium citrate tube for each test. Your inversion rate for this is 3 to 4 times. Then you have your mint green, which is your lithium heparin. Your inversion rate is 8. Your lavender, which is your EDTA, your inversion rates are 8. If you forget your inversion rates for the tube, it is okay to invert up, but never down. So when I was first learning, I would invert the tubes 8 times just to make sure that everything was full. Then you want to place, not full, but make sure that everything was mixed properly. Then you want to place your gauze pad over the puncture site and remove the needle. Activate the safety immediately once the needle is removed from the arm. This is something that in your clinicals, if you do not do, I will fail you on. If you do not pop your tourniquet within a timely manner, if you do not put your safety on, and if you do not ask the person their name and the date of birth, that is an automatic failure. These are things that OSHA and CLIA, which is our clinical lab assessment agency, will get us for and cited for when they come in to do our monitorings. So once you put the safety on, you put that immediately in the sharps container. Do not lay the needle down on the table. That also is a strike against you on your exam. You want to apply pressure and apply the Band-Aid. Allow the patient to sit for at least 2 minutes. You want to check the bleeding. After the bleeding is stopped, you put on a Band-Aid. You want to make sure that you label all of the tubes in front of the patient, confirming again the patient's name and the date of birth. Do not let the patient leave without verifying the tubes and the needles. At the end of the blood draw, you want to answer any questions or address any concerns that Emma, the patient, may have. You want to thank her for her time, and then you allow the patient to leave. All right, any questions on this case study? All right, we're going to move on to the next item.